This is Live from My Office, and when it comes to choosing podcasts, I'm glad you chose this one, even if your finger slipped and you made a mistake. Hey, thanks for being here. Wherever you are, on whatever podcast platform you're listening, subscribe, rate, review, follow, like, all of those cute little social media and podcasting terms that we use to make sure that you are a regular listener. And, just subscribe. Subscribe and you're in. Subscribe and you're in. You'll get every episode. It's appreciated. Thank you, to David Hochberg and Team Hochberg at 855-56-DAVID or 56david.com. He's our title sponsor, and we thank him for that. On today's episode, we got a busy one, so we're going to get to it fairly quickly here. Dr. Kevin Most is back, and he's going to talk to us about the Delta variant. And the Delta variant isn't when Delta Airlines calls and says, we've switched your flight. The Delta variant is a very dangerous, now the number one variant of COVID-19 in America. And it's killing people around the world, and you need to know more about it. And Dr. Most is here. And one of the things that really surprised me when I spoke with him, I'll play it back for you in just a moment, is who this hits hardest and hits most. So stand by for that. And then the second segment of the episode features my old friend Lester Munson, lawyer, writer, one of the great sports writers, period, and an analyst, and just a good guy, and a guy that's been sober for years and has turned his life into trying to help others get there. Board chair at the Hazelden Betty Ford Foundation. He joins me to introduce their new president and CEO, Dr. Joseph Lee. They'll both be on, and they have some very interesting things to say about addiction. And I come from a family of professional addicts. It's a personal topic to me, probably to many of you as well. So that's coming up. Want to remind you, you can email me anytime at thecochronshow@gmail.com, like Judy O'Hare did. Listen to this nice note. Judy writes, just finished listening to a few of your podcasts. Thank you. I can't tell you how listening seems to just settle me down, or better yet, returns me to normal. You're funny, level-headed, and cover great topics. You also bring in wonderful guests. Kudos to you and to Ross Cochran as well for keeping us up to date. Thanks again, Judy O'Hare. Judy, thank you. You made my day. Now get out there, everybody, and download the podcast for somebody that doesn't know what a podcast or a download is, and let's make the world a better place, one new podcast listener at a time. Back after this with some important information you need to hear from Dr. Kevin Most on the Delta variant. You're listening to Live from My Office. Are you purchasing a home and are you tired of getting your offers declined? You need to do what I did. I called Team Hochberg, a trusted local lender who will always look out for your financial best interests. Your offers are being rejected because they didn't stand out from the other 10 or 20 that are sitting there. That's why you need to call Team Hochberg to learn about their 21-day close. Make your next offer stand out by telling the seller, Team Hochberg is originating your loan, and your loan will be closed 21 days later. 21 days within the home inspection time and attorney review, that clock will be ticking. And the bottom line is this, a cash offer is the only offer that's stronger than a Team Hochberg 21-day close. Team Hochberg helped me and thousands of my podcast listeners purchase homes within 21 days of the home inspection and attorney review. My son and daughter-in-law just did this. If it's good enough for them, I'm recommending it to you. But they can't help if you don't call 855-56-DAVID or go to 56david.com for more information about how to make your next offer stand out with the Team Hochberg 21-day close. Call 855-56-DAVID or visit 56david.com. That's 855-563-2843 or 56david.com for Homeside Financial and Equal Housing Lender, NMLS number 1124061. It's the great Dr. Kevin Most, voted most often to be booked on this show because he's that good a friend. Do you know that compared to other guests, Dr. Most, you're on, I think, 10 times to every one time the others are on. How do you feel about that?
Well, 10 to 1 is a good ratio, Steve. I'd probably prefer 20 to 1, but I mean, I can live with 10 to 1. Those odds are fine with me.
Well, here we are. We're recording this on July 2nd and going into a holiday weekend. So whenever you're listening to this, before or after the holiday, the conversation is relevant because people are traveling at almost the same numbers as they were prior to COVID. And if you're saying, well, why is that a big deal, Dr. Most? Because we're all vaccinated. Well, we're not all vaccinated, and there's something called the Delta variant. So let me start with the vaccines. Do we know what the numbers look like, and are we getting any better?
It's interesting. It's usually say it's the haves and the have-nots, but in this case, it's the haves and the don't wants. So those individuals who wanted to be vaccinated, even the ones that were a little apathetic, have gotten the ability to be vaccinated. Now you have this staunch group of I am not going to get vaccinated, which is the biggest problem, the biggest issue. We have vaccines now at all our convenient cares. Our numbers have dropped to where we're doing one maybe a day.
Wow.
So concerning that, we've hit this wall of those individuals who have decided I am not going to get the vaccine. Okay, that's where we're at right now, which with the Delta variant out there, boy, I'll tell you, just personal opinion, I would get vaccinated knowing what this variant is doing across the world and how much protection you're going to get just from the vaccines we already have.
All right, so tell me about the Delta variant. What is it? How bad is it?
Well, it's bad. So it was first found in October in India and was really thought to be, could we contain it to India, which obviously we know we can't. Much more transmissible and an increased risk of hospitalizations with Delta over the maiden COVID. And the bad thing is now it's in all 50 states. It's doubling as far as its percentage every 5, 6, 7 days. It will certainly be over 50% of the cases here, probably by the end of the weekend. We're at about 25% of the cases. And highly infectious, and those individuals who are not vaccinated, who are going around without masks because they don't want to do that, those are the ones who are going to be at the biggest risk. Us who have been vaccinated are still going to be very well protected.
So we don't know who's vaccinated and who isn't. We've had these conversations. I know you have as well, where you're walking into a grocery store and they have if you're fully vaccinated, you don't have to wear the mask anymore. Well, it's all the honor system. There's not much we can do about that, I guess, right?
No, it's interesting. I've been a couple public places, and I didn't realize that the state of Illinois was at 100% vaccination rate. You look at Wrigley Field, there's nobody wearing a mask. That means that either Cubs fans are all been vaccinated,
right,
or 40% of that crowd should be wearing a mask and are not. The thing that they all have to understand is that they think that they're putting us who have been vaccinated at risk. They're not. All they're doing is putting themselves at risk at this point. So not wearing a mask, if they think that they're cool, I can tell you, just look at the stories in the news right now. Talk to somebody who's in the hospital right now, and they'll tell you, I wish I got vaccinated. It's that clear cut.
And the Delta symptoms similar?
Yeah, very similar. A little bit more severe in those that are, when I say middle age, anywhere from 20 to 40, much more respiratory. So we're really concerned in that age group about long haulers as well. So that's really probably one of our bigger concerns. And there's a little bit more of the respiratory as well as cognitive in the Delta variant that we're kind of getting concerned about.
Is the cognitive the brain fog thing we hear about?
Correct. The brain fog and how long it lasts. Now, people say, well, you don't know because it's a variant, it's new to the States. So those individuals that have it, perhaps they're going to get out of it. And that's true. That's very possible. It's still in its infancy here. We just know that it's at a higher rate than what we've seen with the native COVID initially.
So you said 20 to 40. That's a surprise to me and probably to a lot of people. Do we have any idea why it's hitting younger people who, are generally healthier?
Well, it's interesting. If you look at those over the age of 65, and really if you look at those over the age of 60, our vaccination rates for that group is pushing 85%.
Right.
So it may impact that group as well, but we don't know because they're so well protected right now. Now we're seeing this socially active group in that 20 to 40, 20 to 45, which is now, boy, everything's off with the state. We're starting to get more active. That's the group that's getting hit, which is not surprising because we know the kids do fairly well with this illness. This is the group that we're concerned about now.
So is there a breakthrough component to this where even if we are vaccinated, we're in trouble, or we're seeing that in just the rarest of cases?
Extremely rare. If you look at hospitalizations and deaths right now across the country, 99.5% of those fresh, newly hospitalized and deaths are individuals who were not vaccinated. So we are not seeing any, at least in the Northwestern system. We only had maybe one or two breakthroughs where somebody was actually sick enough to be hospitalized for a short period of time. But those in the hospital right now, in our intensive care units, are individuals who had the opportunity to be vaccinated and did not get vaccinated.
There is not a word that could be said that we haven't already said to people. I don't know how you break through to those who just think they're going to skate through this. And, I got to be honest with you. I'm concerned about the next pandemic, and there will be one, because there's going to be a lot of people walking around going, oh, I didn't get it last time and I didn't get it. But again, I hate to just throw stuff out that pisses people off without any action plan for anybody. I just don't know what we do about it when all we've done is preach. And by the way, that's what we should have done.
Absolutely. And I can tell you from the healthcare view, it's getting discouraging and it's getting frustrating. And the patients now that you're trying to, quote unquote, talk into getting the vaccine are those that are totally against it, and they are getting frustrated. So now the healthcare profession is almost getting to a point of saying, okay, I've done everything I can. I've made it as available as possible. I've educated as much as I can. Your healthcare decisions are in your hands. And now we look at it and say, we're going to have to hope that individuals get COVID and then that their circle of friends then realizes, oh my gosh, this is real, and I'm going to get vaccinated, almost by threat of a friend who didn't get vaccinated versus us telling them to get vaccinated. Yeah. There's plenty of people, just watch the videos, there's plenty of people that are taped in the ICU saying, oh my gosh, yep, I wish I would have gotten the vaccine.
Yeah, we're almost like petulant teenagers in this country to a point now where, I don't want to hear it from my mother or father, but if my friend tells me, I'll listen.
That's exactly it. That's exactly what we're going to have to hope for now, because we really kind of run up against the wall against individuals who are, in the hesitancy portion of it is gone. Those individuals, I think, that were a little bit hesitant have now looked and said, oh my gosh, billions of people have gotten this vaccine. All we have seen is the numbers go down, the hospitalizations go down, the deaths go down. Okay, it must be working. The ones that are left are the ones that are saying, I'm not getting it.
So the Delta variant, nothing to be messed with. If you haven't gotten your vaccine, it's never been easier to get it. Is that true?
Absolutely. I mean, you can't walk into a pharmacy or a grocery store right now or into a doctor's clinic where you could not get a vaccine without waiting. And, look, some states are doing incentives. They're giving gift cards. They're putting you in a lottery. I mean, we're taking this seriously, that what we're looking at in the health is public health, and the cost to public health and the decrease the spread of illness across the world. We're fortunate here in the United States. I mean, there are countries that would be begging for vaccine, and here we are people turning it down even though it's right there. I mean, look at our vaccination rates and compare them with Africa. Compare it with any third world country that is still being devastated by this illness. And we should be embarrassed that we're not following up and getting vaccinated to do our part to stop the spread.
Yeah, it's just this perfect storm of stupid that's a much bigger conversation. But the idea that we're America, so we're going to survive this because we're America, it's scary stupid.
Yeah. Yeah, and a lot of individuals right now who got vaccinated are like, okay, do I need a booster now? That's another thing. We have this, like I said, we have the haves and the don't wants. The haves are now looking at it going, wait a second, I know the Delta variant's out there, what's going on? They need to be very clear. Pfizer and Moderna have been studied very close. Their effective rate drops down a little bit from like 94, 95% down into the high 80s, but still well above the 50 that the CDC wanted, even against the Delta variant. So we're also finding studies now that are saying the antibodies and the immune response is not waning as fast. So in fact, we may not need a booster for 2 years. Nonetheless, people thinking that we may need it sometime in the spring.
It's a small percentage of people, but for the needle phobic types, the folks given these vaccines, they've seen everything, right? So there's no reason to be embarrassed about that.
Yeah, absolutely. I mean, people pass out. We know that. We get them passing out from that is something called vasovagal. It's very common. We treat it all the time. That's not an issue. And then I would say the other is get the shot this time. Any boosters, right now, they are working on a nasal shot, just like we have flu mist for influenza. They are working on one now, trying to prove that that works to take care of those needle phobic individuals. But I would not wait for that research to be done before I stepped up to get the vaccine now.
And the one consistent thing I hear again, because we're going to run out of time here, is, people that go, I might want to have kids. These are younger folks. I might want to have kids someday, and I don't know if it's safe for me to take it. Mothers or potential fathers, what's your level of concern there?
Zero. I mean, individuals have to realize we get vaccinated for so many illnesses right now. Why would we be concerned about this one? They say, because it's the mRNA. The mRNA, all it is another tool that the body uses to develop something to make sure our immune system sees something foreign. It is nowhere near our DNA. People think RNA, mRNA, and DNA are so close. This vaccine does nothing close to the nucleus that impacts our DNA at all. And if you look at it right now, the studies that have been done on those individuals who got pregnant after being vaccinated, who were vaccinated while pregnant, this had no impact on the outcome of their delivery.
And it gives you a chance to actually experience being a parent without being sick or worse. Last question from me, and then if there's anything you missed, you'll let me know. But masking in a world where the honor system is not honorable, as you mentioned, kidding, obviously, that we're at 100% fulfillment. Nobody is. Would you wear a mask outside in a crowd with a bunch of people?
I wouldn't. You know what? I mean, I look at it and say, I'm protected. Individuals who are not wearing the mask have to understand that when we all wore masks, it was because we were concerned about this asymptomatic spread and the inability to make sure enough people were vaccinated. Right now, myself wearing a mask is not going to do that much more to protect me. In other words, if this vaccine that I took is 95% protection, then I am going to wear the mask to make sure I don't get that potential 5%. Kind of like belts and suspenders. I want to be extra careful. Now, people who may be cautious or have anxiety about this, go ahead and wear a mask. It's totally fine. But the individuals who are not vaccinated and don't want to wear a mask, I can't. Those are people we'll see in the emergency room and in the hospital and say, what were you thinking? Because we've made it very clear that if you're not going to get vaccinated, the only way you can protect yourself is to wear the mask.
Yeah, it's so sad. It almost makes me want to laugh, because if you told me I would walk into a grocery store or any crowded indoor event and everybody in there could have a cold, but we don't know who, I'd want to have a mask on, because I know how miserable a cold can be. Well, this is 1,000 times worse.
Absolutely. And it's kind of crazy. It's kind of like I'm going to drive without a seatbelt on because I don't believe in seatbelts. And I don't think that a crash is going to impact me at all.
Right. Tell that to your head.
Right. And those of us who wear seatbelts say, I don't care about you who don't wear a seatbelt. I'm wearing my seatbelt because I'm protected now. If you don't want to, you've made a decision on what you're doing for your health and safety. And I'm sorry, if we didn't make it clear enough with seatbelts and how much they've saved people's lives, just like the vaccine, then you're making a decision that you're just going to have to live with the repercussions, not only you personally, but potentially your family and friends.
Busiest doctor I've ever known, Dr. Kevin Most, who always takes time for us here on Live from my office. Did we miss anything?
No, I think we're good. I'd say those individuals who are traveling, this weekend, depending on when we put this out, just be careful if you're heading to the South. The vaccination rates in the South are so low. You look at Mississippi and Alabama and Arkansas, even into Georgia. You're talking up here where we have 65% vaccination rates down there. They're not even hitting 30. So that means that 70% of the people are walking around unvaccinated. So I would just say be careful down there. But for the most part, it's in the hands of the individuals at this point.
Well, let's go out and have a great summer and be smart and not be stupid, and just remember how shut down last year was and hope that we don't get there again. Dr. Kevin Most, always great. Appreciate the information. And now get back to the 47 other jobs you have.
You got it. Take care. We'll talk soon.
If you're looking to purchase a new home or refinance your existing home, you need to do what I did. I called Team Hochberg, your trusted local lender who's always going to look out for your financial best interest. Your credit score is the number one factor that determines your interest rate. The difference between a 699 and a 740 score on a $250,000 mortgage will cost you an additional $25,000 in mortgage payments over that 30-year fixed loan. You heard me. An additional $25,000 that you'll never see. It's just gone in payments over the life of your mortgage unless you get that credit rating up. And to enhance your credit and to secure a lower rate, pay off or pay down your credit cards every Friday and get added as an authorized user on the credit card of someone with great credit. These are the tips and tricks that Hochberg knows. They're all legal. And this is the kind of time he can save you because he's doing the thinking for you. Team Hochberg helped me and my family and thousands of my podcast listeners enhance their credit to secure the lowest rate before purchasing a new home or refinancing their existing home. But they can't help if they don't have you on the other end of the phone. Pick up the phone and call or jump online. It's 855-56-DAVID or 56david.com. Your part's easy. They'll do the heavy lifting. 855-563-2843 or 56david.com for Homeside Financial, an equal housing lender. NMLS number 1124061. This is live from my office, and it's great to see my old friend Lester Munson. Let me just brag about Lester for a second. He is a sports writing legend. He is a writer of incredible gifts. And I think he would agree with me when I say he's probably doing the most important work of his life right now with Hazelden Betty Ford. How are you, friend?
I am very well, and you're right. This is most important work. It's inspiring, it's rewarding, and we are doing some really good stuff.
I'm going to let you introduce the doctor here because we have exciting news from Hazelden Betty Ford. Who are we looking at here, and who are we listening to?
We are going to be listening to Dr. Joseph Lee. He, as of a couple days ago, is the president and CEO of the Hazelden Betty Ford Foundation. We, as you know, Steve, are the largest nonprofit provider of treatment for addiction and alcoholism. We are in business on 17 locations across the country. We searched the entire nation for a new CEO, and we found Dr. Lee right here among our own staff. He was presiding over our adolescent treatment center in Plymouth, Minnesota. He is a distinguished character, all sorts of credentials, Phi Beta Kappa as a philosophy major. I didn't think there were any right answers in philosophy.
Wait a minute. How did he not go to the University of Chicago as a Phi Beta Kappa philosophy major?
Well, he was in Oklahoma, and I think the tuition was pretty good at Oklahoma University.
Dr. Lee, it is a pleasure and an honor as well to see someone not only with a full head of hair, but a man of color and diversity that every organization needs to take a closer look at to take the leadership here, which I know Lester will help you guide along the way as well. But congratulations on the job.
Yeah, thank you very much. I was commenting to somebody because they were asking me, how does it feel? And it really feels like a privilege, to be honest with you, because last year I was a frontline clinician, tip of the spear in our stigmatized industry during the pandemic. And the pandemic, as you know, is still going on.
Sure.
And being an organization like ours, it was hard for us to get masks and testing kits. And so we've been through a really tumultuous year and a half, but what it really showed was the character of our organization. So to be able to take the helm of the organization like this with other servant leaders like Lester, it's a true honor. And so for this conversation, though, please just call me Joe.
Okay, I appreciate that. For the sake of those who don't know, if you've listened to me for years, you do. So I pardon the redundancy of the story, but I come from a family of professional addicted folks who I love very much and are good people, but they were subject to these addictions, and I saw the damage it could do. So this has always been a cause close to my heart, as I am Olympic level codependent, or at least I was. And those are separate conversations, but the specific issues that you deal with at Hazelden Betty Ford include something we don't talk about much. We talk about drugs and alcohol. We don't talk about mental health, do we, Doctor? Or Joe, I apologize.
Yeah, people are actually, they talk a lot about mental health, and the two come together. And just like high blood pressure comes together with high cholesterol more often than not, and so they come together and they should be treated as such. And that's our philosophy. When you treat the person, you end up treating all kinds of things that person may have. And it's mental health issues, addiction issues. You tackle them together. You approach it not only through the individual lens, but also through a systems lens, through their family and their environment. And that's how we do it. So many people with addiction issues also have co-occurring mental health disorders. And we recognized that long ago. And so we have triple boarded psychiatrists, psychologists who specialize in addiction, who are full-time employees of our organization. We were really committed to it. And so we've invested the resources to make sure that we can deliver those mental health services.
Well, there's a lot of growing up we all need to do in regards to how we look at things. And Lester, you know this, because we run into each other at other organizational events that promote better mental health as well. I've lost a couple of friends to suicide who are dealing with things like bipolar disorder or drug addiction related to the same. You don't snap out of it. You don't snap out of drug addiction. You don't snap out of alcohol addiction, and you don't snap out of better health. It's difficult for people to hear when you have someone you love. But simple phrases like, if you love me, you'd quit, they don't work, do they?
No, they don't. It is really interesting to see how recovery works, both in addiction and in alcoholism. I am 37 years sober myself. I know that it is basically a 1 day at a time. At the beginning, it's 1 hour at a time to try to shake off what it is that has begun to ruin your life. We at Hazelden are totally committed to a 12-step approach, along with the medical assistance that Joe described. And it's a great combination for somebody who is suffering. And we are having very good success. Our people, when they graduate, they don't graduate, they go into a continuum of care, and we try to provide for them all along the way.
Well, and that really is the key, because it has to be someone who is willing to admit they're at their bottom, that they want the help, and most importantly, that they want to live. I went through this with my brother, who has now been sober for 18 years. And Joe, people would come up to me. My brother has special needs, which is an extra hurdle. And people would come up to me and go, "Oh, it's so great what you did for your brother." And I make the point to them is he had to decide to save his own life. He had to decide that he wanted to live. And how big a piece of that is for the folks that come to Hazelden Betty Ford or seek help wherever they seek help.
Well, that's a really great point. I think I'm glad you brought it up, because our care, like every other care, has evolved and advanced, and we've incorporated the science on top of the beautiful 12-step tradition. Prior to the pandemic, research came out, a good review research paper from John Kelly at Harvard that showed AA works, especially for alcohol use disorder. So we know that we have a scientific basis in our 12-step model. That said, we incorporate a lot of scientific methods, and we haven't seen contradictions. And whether that's medication for opioid use disorder or psychotherapies that help us meet people where they're at. So what you said about some decades ago, kind of people have to hit bottom and then they kind of come. And while there are people like that, our philosophy now is, people don't even have to want to be sober, but if they're wanting to just have a conversation, if they're willing to talk about it.
Well, that's where it starts, I guess, right?
That's right. We're gonna hang on. And so anymore, I'm in addition to a strong 12-step background, I'm a motivational interviewing trainer, and it's a kind of therapy.
Sure.
And the way that works is, if someone says, "You know what, Doc, I'm going to stop using heroin, but I'm going to continue to drink." And in the past, we'd say, kind of give them a lecture and da-da-da-da-da. But, for the past decade or so, what we've been doing more and more of is this motivational interviewing. So we'd say something like, "Why do you want to stop using heroin?" So we take the win, we build that rapport, we show the love and the empathy, which those values really are the core of our recovery. And we've been able to help a lot more people. And so the way I think people would be surprised how sophisticated our treatment methodologies are and how scientific they are in meeting people where they're at, addressing mental health issues. And then I also got to add, on that mental health tip, last year to this year, I've had more people reach out to me than ever before for mental health issues, for their kids, their loved ones, family members. Emergency rooms are full during the pandemic.
Sure.
And what that highlighted to me was just how isolating both mental health and addiction issues can be for people.
Well, it's a fascinating approach, because Lester, you know this, and I know you went through this personally as well, where the people who love you the most really struggle. What do they say to you? how do they help? In mental health discussions, we talk about it all the time, where instead of saying, don't talk like that, you have so much to live for, you say something along the lines of, I want to help you. What can I do to help you? Here's some things I found, resources that I found that might be worth considering. Why don't you take a look at these? So it's a piece of, I think, what Joe was talking about with Take the Win. Do you see it that way?
Absolutely. And I think we all know that addiction and alcoholism can be a family disease. At Hazelden, we have programs for the family, as well as we have programs that Joe has described for the addict and the alcoholic. In my case, my family suffered from my alcoholism, but thanks to Al-Anon and other programs, we all got back together. So it does work.
And that's the miracle of it, Lester, and you experienced it. And Joe, this is one of the things that really gets me excited about Hazelden and Betty Ford and your leadership as you go forward here. This is really a marriage between faith and science. It's the best of science, it's faith, and it's hope. And hope is such a big word, because in the middle of the throes of addiction, the victims, the family members, and certainly the addicted, there isn't hope, or certainly not enough hope. What do you want to say about that?
Yeah, in the end, I think it comes down to values, because we're people, and it really is about things like hope, connection. I talk a lot about humility, empathy, and grace. A person and a family's journey through recovery, the transformation, and the adherence to values it takes. And believe it or not, there are scientific leanings in that, and so that marriage is natural. So there are many reasons for us doing both. I think there's something magical about the recovery tradition, how it's grown up in grassroots levels in decades when medicine didn't recognize addiction as a disease. And that's something that we're very proud about, and we're always going to keep, because fundamentally, those are the changes I see in people in recovery. They have just a different feel about them, and they have a different, and they become who they're supposed to be. And the scientific part of it helps us sharpen things on a professional level. It allows us to measure things and show outcomes. And that's important because of stigma. For us to really get addiction recognized as a mainstream healthcare issue, which it is, but it's not always seen that way, even now. We have to be able to show the data. We have to be able to show that what we do is reproducible and it works. And we're able to do all of that. And due to that, we have this fabulous marriage where before, I think some people found the scientific model to be somewhat sterile and overly tactical. You know what I mean? And then people found from a scientific standpoint, where to get the traction in the connection. How do you translate the language of recovery that people have experienced, millions of people have experienced, into something that gets traction in the scientific community. And we see ourselves as those bridge builders. And we've been able to do that successfully, even better since the opioid epidemic really taught us a lot of lessons. And so for the past 10 years, we've really been cranking it up in that way. And it's made us better.
Where I have hope, and Lester, our kids and my grandkids, and I forget, Lester, do you have grandkids?
I do. I have 4
grandkids. Our kids' generation and our grandkids' generations are so much better at this than we ever have been. The acceptance that everybody has something, or the acceptance that somebody has an even bigger hurdle to get over. Maybe I'm being a little Hallmark cardish here, or a little idealistic, but I have a lot of hope in the next generation and the generation of our grandkids after that they can help move the ball forward too, because of that, I don't know, that heart and that built-in empathy.
I think that's exactly what happened. We can look forward to that as something that is going to happen. I think that we who work in the world of recovery have become increasingly conscious of the difficulty that stigma provides. We have people who, because they're worried that someone would think less of them because they admit they have an addiction problem, will not come to us or to anybody else for treatment. One of our priorities at Hazelden and Betty Ford is to try to reduce the stigma and to try to explain even to the medical profession and to nurses in emergency rooms and other places that the alcoholic who comes in there is entitled to the same treatment as the diabetic or the heart patient.
100%.
And that is now, I think, is gradually taking hold, just as you suggest, Steve.
So I want to talk to you about what you both hope for going into the future, because Joe, I don't know if you know, you got a fairly big job here. But I want to mention two things before we get to that. One is, as time goes on, especially speaking of younger generations, the name Betty Ford is maybe not so familiar. Betty Ford did a miraculous thing when she stepped up and spoke about her own addiction. And at Hazelden, Betty Ford, I know you honor that, but I think it's important that we remember that when people in the public limelight speak up about these things, it makes those who are suffering from addiction feel a little bit less alone. And those voices can be louder than the mom or the dad or the brother or the sister that they hear from all the time. Is that still true?
Yeah, I think so. And we're going to do everything to honor Betty Ford's legacy, because I think for a lot of people, for all the benefits of technology and the modern age, we've become more short-sighted about our history. And believe it or not, prior to the opioid epidemic, we had an addiction crisis in this country, like many others. And there were people who, before a time that society accepted it, and there were newspaper articles all the time, had to step up as pioneers before others and have the courage to stand up for people and give a voice to them and share hope. And that's what AA was. That's what our organization is. And that's certainly what Betty Ford was. And so we do everything we can to bring that legacy up, because that kind of courage in history, I think, is something that shouldn't be forgotten. And it's a place that we have as an organization. She exemplifies it perfectly. And so it's not just broadcasting the details of her story, but communicating that spirit, that right. courage and the bravery to stand for something that is true and right, maybe even when the majority of society don't quite see it that way.
Let's talk about funding for a second. It costs an awful lot of money to do what you do every day for all the people that you help. How are you pulling that off?
Well, the great move, and one of the reasons that I stayed, and this is, I'm just being very honest here, I
take notes, Lester. You may not have heard this when you talked earlier.
You probably heard a lot of my stories, but when I was at Johns Hopkins, that was maybe 13 years out of high school that I had done college, medical school, residency training. So I was tired of fellowships, and so my office mate actually went to Harvard for an addiction fellowship, and at that time, you could get your addiction fellowship just by working. Getting a working year, and it's called the practice pathway. So I chose to do that, and that's why I came to Minnesota. And my plans were in the back of my mind that I would just go back to Maryland and open a private practice or do whatever I wanted to do. And that was the plan. And it changed. It changed because of our outgoing CEO, Mark Mishik. And one of the things that I saw, the promise of the organization that I saw, is that at a time when all other rehabs, quote unquote, and I abhorred the word, I don't like the word rehab because it really is stereotypical.
Yeah, 100%.
But a lot of other rehabs at the time were building swimming pools by the beach and serving latte and how many massage sessions you could do. And they were in this amenities game for fee for service private pay. And we took a radically new direction as soon as we came in. And we said, we're going to take insurance. That's how we need to go, because we need to lower the cost of care. That's a commitment we took, and we took a lot of flack for it. We had to make sacrifices within an organization and tighten our belts for a while until we got in network, but it paid off. And it was, again, kind of like Betty Ford's choices and decisions to speak up, a courageous decision, and it moved us in the right direction.
And the insurance companies have become more accepting through the years and have become full partners now?
Absolutely. And the way we work with insurance companies is just like we do with our patients. We meet them where they're at to start. We build a relationship. It's positive. In fact, a board member at an insurance company commented to me that our approach to working with insurance companies is different than other organizations or hospitals. It's not confrontational. And so we carry that same spirit. And so, because we know at the end of the day, for all the problems and the bureaucracy and there are problems, okay, in the healthcare model, there are. And so we're not minimizing that at all. For all of that, bottom line is we have to try to lower cost of care and serve more people. And we've done that.
Yeah, Lester, I'd be remiss if I didn't at least cover my codependent brothers and sisters in a question to you. And that is this. When my brother first became sober, my parents had both passed. And as I said, he has special needs. And one of my great concerns was we grew up in a small town. He was back in the small town. And I hadn't learned as much as I hopefully have learned and maybe even communicated here. So the small town that we grew up in is Ithaca, New York, upstate New York, a little south of Syracuse. Beautiful area. But lots of small towns have lots of bars and lots of folks who want to tie one on at the end of the day. And I think about you in the throes and the peak of your career in sports, surrounded by that post-game atmosphere. What do you say to families who are concerned? Okay, he or she, they're sober, but now I've got to watch them 24/7 because I don't know what's going to happen if they go into this bar or that bar. Because frankly, I had a friend who said, look, you got to let go, man, because I got to be able, if I don't want a haircut, to sit in a barbershop for 3 hours and not get a haircut, which I love that analogy. But what do you say to that?
What I would say to that is that we who are in recovery, we understand how we got there. We know that DNA is a factor in all of this. We know what can and might happen. And at the same time, I have 2 sons. I have 4 grandchildren. There's no indication of any alcoholism in anything that they are doing. There is such a thing out there as a social drinker, somebody who can order a drink and then put it down on the table and not finish the drink. This is incomprehensible to a drinker like I was. Absolutely incomprehensible. Sure. We had scorn for social drinkers, but it is possible to survive out there, to subsist, and to live a wonderful life. We are not a temperance group. We understand that things happen out there and that we must accept them. And so it's a fine line that you walk, but once you have a little bit of sobriety, it becomes easier and easier to walk that line.
That's a really important point. What do you both want this organization to do moving forward? Because you're running pretty good on all cylinders now, but I know there's always things you want to improve, things you want to do. Lester, take that first.
I think what we want to do at Hazelden Betty Ford is to expand access to our services. We have already done a lot of that under Joe's predecessor, the aforementioned Mark Mishik. He did a great job on that. Now with technology and with other initiatives, I think we can expand to many more states, many more people, so that somebody who needs help will have immediate access to the help that they need. That would be my primary goal for us.
Joe, what do you want to add to that?
Well, I think Lester's correct. We want to meet people where they're at using technology. We're also looking aggressively at Medicaid, going further with lowering costs. Are there ways to do this? And we're looking at that bravely. We also talk a lot about broadening our banner. We want to get more people excited about what we're doing. And that also means serving a more diverse patient population and having more diverse leadership within our organization. And that's important because not only am I the first physician CEO, I'm the first immigrant and first person of color. And the symbolism of that, I've had people come up to me because they now see opportunities for themselves into the future. And we have to represent that broader brand. And so we're going to uplift those voices, those other voices in the community as well. And so there's a lot of exciting things for us. And we have the right history and pedigree and integrity in our organization to be able to carry that, I think, for a lot of people. And it's a big burden, it's a challenge, but it's exciting.
Last question, because I'm late here and I'm going to get in trouble with you guys. And I don't like stepping on other people. So I think. But for people listening now, there's a lot of people in pain out there. And if somebody wants help, and Hazelden Betty Ford could be an answer here in Chicago, on Dearborn, or around the country in various places, certainly Minneapolis, St. Paul. Either one of you, what do you say to that person who wants help and hasn't made the call?
I would encourage that individual to make the call. Do not hesitate. It is the best call they would ever make. And now is the time to do it.
It's an absolute life changer. It changed, it's a life changer and a lifesaver. Joe, what about the other end of that? You love somebody and you can't love them hard enough to get them sober. What do you say to them?
Family treatment has evolved, actually. So we can actually teach family members skills that can get loved ones into help, reduce that person's substance use, and improve the quality of life for those family members. And so we actually can now do that. And so we've even advanced our family game. And I think a lot of people have a lot of stigma about what treatment for addiction is. They all think it's residential. They think it's, and it's not that way. So in terms of making that call or reaching out, it's not that way. It could be virtual care, outpatient care, prevention services, family care. We'll meet you where you're at, whether it's medications or therapy. There's lots of ways to do it, but you just have to reach out.
And the best way to contact Hazelden Betty Ford Foundation is what?
You can go to our website, and there's a 1-800 number, and you can call. You can also contact us through online. There's more and more ways to contact us than ever before, right? And it's really easy.
And check out the show notes. We'll have all those appropriate links here. Dr. Joseph Lee, congratulations. I know you're going to do a great job. And from what I've heard in your first 30 or 60 days, you haven't messed up yet.
So far, so good. I got a lot of good help.
Lester, it is always a pleasure to see you, my friend. I wish we could do this more.
Thank you, Steve.
God bless you both. Thank you again to Lester and also to Dr. Joseph Lee, who I know is going to be great in that job. And it is one of the most important jobs there is. I just implore you, if you are struggling with addiction, you can win. You can beat this. Yep, one day at a time for the rest of your life. That's the program, but you can get there. But you have to believe in you. You have to want to live. You have to want to save your own life. And I know you can do it, and I hope you will. By the way, we do a charity on every episode, and while Hazelden Betty Ford Foundation is a big organization, there's never enough funding to do all the good they can do, and you can donate at hazeldenbettyford.org. That's HAZELDEN bettyford.org. Hazelden Betty Ford, one word, .org. And I hope you will. Thank you, Ross Cochran, for putting this all together as you always do so well. And I hope you'll listen to my son Ross Cochran's own podcast, Resilient Disciples. And you can get that on just about every podcast platform as well. And before we go, obviously, thank you to Dr. Kevin Most, the most put upon guest on this podcast, because we ask him all the time and he always steps up. Take care of yourself. Get the shots. It's our best shot. It's our only shot. All the cliches and catchphrases apply. Get the shot. Thank you. Mask up where you feel like you need to, and don't feel bad about it. My name is Steve Cochran, and I thank you as always for listening to Live from My Office.
Thank you for listening to Live from My Office, a service of Monkey Run Productions. All rights reserved. The podcast is hosted by Steve Cochran, and it's mixed, edited, and produced by me, Ross Cochran. Support the show by subscribing wherever you're listening and by telling your friends about it. Follow Steve on all social media channels, including Facebook, Instagram, Twitter, and LinkedIn. And make sure you check out this episode's show notes for relevant information discussed during the conversations. You can also email the show directly at thecochranshow@gmail.com with any questions or comments. And that's the best place to tell us about your favorite nonprofit so we can make sure we mention them on the next episode. Steve is available for corporate speaking gigs. He would love to MC your event. And occasionally, he's funny. Thank you for listening. Head to cochranshow.com for more.